Good morning, everyone. Good morning, and thank you for being here. Bienvenidos a todos. Muchas gracias por estar aquí con nosotros. My name is Adriana Ramirez. I'm the Executive Director for Federal Programs, and I want to welcome you to one of our parent sessions. Today, I know that it's going to be very interesting, a lot of important information, especially for our community. We're going to be talking about diabetes, and then we're also going to be doing a section on nutrition. So I know that it's going to be a lot of good information, and I'm very happy that you're here. As parents, anything that we pick up, anything that we learn and that we share with our families is going to be more success for our children and our students in our school. So thank you all once again for being here. Before we go on, I just want to say all of my department, all of the federal programs are outside. They're all busy at work, but those that are here, if y'all could raise your hand, be recognized. They're always working hard to make sure that we have our sessions. I do want to introduce Ms. Roxanne Villagomez, our coordinator for parent and family engagement. Also, Ms. Sara Hernandez, our coordinator for federal programs. Joining us, we do have Melissa Ramirez. She is the director of counseling for UISD. Thank you for being here. And so as we go on, there are some of our coordinators coming in. Thank you, Ms. Perla Gonzalez, Isabel Stalema. Yes. At this time, like I said, we do have a special treat today. We do have Dr. Mateo Reyes that is joining us. But I'm going to call up Ms. Sara Hernandez, who I think is the best person to give us a little information on him, a little of his bio. It happens to be his very proud sister. So come on up.
Good morning, buenos días. If you need a translator, si necesitan un traductor, pueden pasar enfrente para que les traduzcan, pero vamos a hablar inglés y español. So, welcome to our UCOP. I'm very happy and proud to introduce my brother Mateo. Mateo is one of my younger brothers. We're 7. A little bit about our family. We grew up in the south side of Laredo. We have very supportive parents. My mom and dad were always making sure that whether we went to school, that we were prepared for school, or we were just driven ourselves, right, as far as wanting to go to school. Mateo is number 4, right? Yes, I'm the second oldest. So Mateo is number 4, and we still have 3 more. We're 7 total. But I just wanted to say that it's so important that you as parents are involved, right, in your children's education, because it is so important that you're there and asking. So, even with humble beginnings, we grew up in the south side, Villa del Sol, and my parents always instilled in us the importance of education and the importance of family. Mateo and I are products of UISD. Mateo went to Salinas Elementary, he went to Clark Middle, and then he's a proud graduate of United High School, 1988. He went to UTSA. Mateo was a star athlete. He was a running back, number 33 for United High School. Go Horns. I'm just kidding. So, but, even as a little boy, Mateo, growing up, he always wanted, to do something very smart. He always stood out. And so I'm very proud to introduce to you my brother Mateo, who went to UTSA, went to UTMB in Galveston, and he made a name for himself, but he never has forgotten where he came from. He helps all the community. He has a clinic in the south, and he recently opened one in the north, and he has a hobby. He's a drummer also. Miss Heel is very proud that her husband was his band director. But, coming from humble beginnings, no matter where you come from, if you have that support, that family support, it's so important for a student, for a child, so we could just give them that extra push, knowing that, hey, I could do anything. If I have the support, I'll find the means. No matter if you have money, if you don't have money, you will, you will achieve it if you really want it and you have that family support. So without further ado, I want to introduce to you my brother Mateo Reyes, Dr. Mateo Reyes.
Good morning. Buenos días. Voy a hablar en inglés, pero para los que no hablen en inglés, yo hablo español, so si tienen alguna pregunta, nada más levanten la mano y pueden preguntar con toda confianza, okay? Right? So my topic today is diabetes, and the reason I'm talking about diabetes is because it's a very big problem in our community, in our culture. So I'm Dr. Mateo Reyes, and my clinic is South Laredo Family Clinic. I'm a board-certified family doctor. So we're going to talk a little bit about diabetes, and that way you guys can understand the different types of diabetes, definition of diabetes, treatment of diabetes, and a little bit about diet and exercise. We do have a dietitian here who will be talking to you more about diet along the way. So 3 types of diabetes. There's the gestational diabetes. That's the one that happens during pregnancy. The significance of this diabetes is that a big portion, 25 to 30% of these people who develop diabetes in pregnancies will eventually become diabetics later on in life. So, you know, that's the important reason why I mentioned that, because I know all of you all had kids or have kids. If you've been a diabetic in pregnancy, you have a high chance of becoming a diabetic later on in life. You have type 1 diabetes. It used to be known as juvenile onset, or the diabetes that the kids had, also known as insulin dependent, because the body produces very little to no insulin. In this particular type of diabetes, you need insulin to survive. If your body's not producing any insulin, and if you don't get on insulin, then it can make you very ill, and people do die when they're supposed to be on insulin and are not taking their insulin. So the one that we're going to talk about mostly today is type 2 diabetes, okay, because that's the most common type. It used to be known as adult onset because you would see this diabetes in adults, but now you're seeing it even in kids, in preteen kids, you know, and the reason that this type of diabetes happens is because the body produces what we call insulin resistance, or the body does not respond to insulin the way it should. So with type 1 diabetes, there's no insulin. With type 2 diabetes, there's a lot of insulin because your body is trying to compensate to normalize your sugars. In the end, all this diabetes equal high sugars in the body. So, and why does sugar exist in our body? What's the purpose? What's the significance of sugar? Why do we need sugar? Well, the brain functions only on sugar as energy. If you haven't eaten and your sugars drop and you start getting lightheaded, you start having some confusion, you know, that's because the brain needs sugar. The body needs sugar as well, but the body is different. The rest of the body, muscles and stuff, they can break down fats and muscle proteins, other things that they can use for energy. But that's the primary source of energy in our body, okay? So elevated sugars equals diabetes, right? And why is it important for you to know if you have diabetes? Well, high sugars in the body damage nerves and blood vessels. So diabetes is the #1 cause of blindness in the United States. Diabetes is the #1 cause of kidney failure and patients going in dialysis in the United States. Diabetes is the #1 cause of amputation or loss of limbs in the United States. Diabetes increases your risk of having a heart attack. Diabetes increases your risk of having strokes. So why is it important for you to know if you have diabetes or not? That's why. So this is this is just a little something to show how bigger of a problem diabetes has become in the world. This is a World Health Organization statistic. In 1980, there was 108 million people worldwide that had diabetes. In 2014, which is our latest statistics, there was 422 million. That's 4 times more people developing diabetes in the United States. Why is that important? Is because in 2019, there was a lot of deaths attributed to diabetes in the world. And 50% of those people were less than 70 years old. Less than 70 years old, half of the people that died because of diabetes were less than 70 years old. The average lifespan is somewhere between 80 and 85 years. So if you have diabetes, you run the chance of having a premature death, younger death, okay? And this just shows our culture because we're Hispanics, right? I apologize, I thought I silenced my phone. So we're Hispanics. Why is it important that I show this statistic? Is because our genes, just being Hispanics by itself, puts us at high risk of developing diabetes. So what are risk factors? I just said primarily is genes. Okay, that's your biggest risk factor for developing diabetes. 2 is being overweight. 3 is carrying a poor diet or a high-fat diet. Age is important in type 2 diabetes, over 45 years of age. I already mentioned having gestational diabetes, or even if you gave birth to a baby who weighed over 9 pounds. If you were not a diabetic, but if you have big babies, that's a good sign that sometime later on in life you're going to develop diabetes. We already talked about ethnicity. People who have high blood pressure, people who have high triglycerides. So why is it important to control blood pressure and control your lipids? High blood pressure and high triglycerides can be a sign of insulin resistance or your body not using insulin the right way. So that's why having high blood pressure and high triglycerides can be not only a risk factor, but something that can predict your risk of becoming a diabetic. Yes, ma'am. So típicamente el azúcar, típicamente es un síndrome metabólico, ¿verdad? So triglicéridos alto, alta presión y azúcar. Esos 3 típicamente vienen juntos. Si usted ya tiene 2 de los 3, hay una probabilidad grande que adelantito viene la tercera. ¿Mande? Ser prediabético, usted ya estableció una 100% chance de hacerse diabética si usted no cambia su dieta, sus hábitos, su vida. Ya cuando estás prediabética, ya, si no haces nada diferente, pronto vas a ser diabética. Así es. Así es. Okay. So symptoms of diabetes: frequent urination, being thirsty all the time, unexplained weight loss. That's a big one because all of a sudden I'll see a patient that lost 20, 30 pounds in the last 6 months, and I'm looking at him and saying, "Hey, are you trying to lose weight?" He's like, "No, I'm just losing weight, but I am very thirsty." And I'll check a sugar right then and there, and it'll be 300, 400 or something like that. So blurry vision, okay? Feeling tired all the time. Well, feeling tired all the time is a very common symptom, okay? But if you're feeling tired all the time with any of the other things, then that's a reason to go get checked. And then increasing hunger. Yeah, I think I have that problem, but okay. So how do we diagnose diabetes? So when you go to your doctor and you're going to ask him, I want to get checked for diabetes. I put these numbers here just so that you guys can know more or less whenever you go, okay? I know you don't have to learn this, but just kind of so you know how we do it, okay? So if you go to your doctor and you have 2 sugars over 126 fasting, meaning not eating or drinking anything for 8 hours, if you have 2 of those above 126, that classifies you as a diabetic. There's a study that we do that's called a hemoglobin A1C. That one gives us your average of your sugar for the last 3 months, and I'll explain how in a little bit. If that number is over 6.5%, that diagnoses you with diabetes. If you have 5.7 to 6.4%, then you're pre-diabetic. Okay? If at any time you check your sugar and your sugar's over 200, you're a diabetic. Okay? Sometimes, like if your doctor gives you some steroids or to treat some joint problem, or or if your body's under a lot of stress fighting an infection, your sugar can go above 200 without you being a diabetic. But those are the only exceptions. If you're not on any medications, you're fine, and you check your sugar over 200, you need to call your doctor immediately. And we used to do what was called a 2-hour glucose tolerance test that we don't really do anymore. But basically they gave you 75 grams of sugar, and then they would check your sugar. They would check your sugar fasting. Then they would give you the sugar load, check your sugar in 1 hour, and check your sugar in 2 hours. If at 2 hours you were above 200, then that would diagnose you as having diabetes. But this is the way we diagnose people with diabetes. Okay? So treatment for diabetes, okay? I know it's very wordy here, but you guys can read that. Medications are always used to treat diabetes. Medications should be used to treat pre-diabetics. So in my clinic, I get people that tell me, no, I'm treating my diabetes with diet. If you're 85 years old and your sugars are not bad, that A1C that we talked about is less than 7, and you don't want to take medication, that's okay. You're 85 years old, you're 80 years old, that's okay. But if you're 50 years old, 40 years old, 60 years old, you need medication despite. And why is that? Because the medications that we use to treat diabetes all have different benefits for the body besides lowering sugar. They lower insulin levels, they protect the kidneys, they protect the heart, they protect the circulation. So if you're a diabetic, you have very high insulin levels in your body. And if you don't take any medication, you're not going to do anything about that, and that's going to in turn affect your blood pressure, that's going to affect your cholesterol, and that's going to increase your risk of having a cardiovascular event, a heart attack or a stroke. Okay? Right? So taking medications is very important. You should also always have an annual diabetic eye exam. We talked about diabetes being the #1 cause of blindness. And people say, no, pues yo miro bien, doctor, And you're like, well, you're not doing it for vision. What we're doing is we're checking blood pressure in the eye, because diabetes increases your risk of getting glaucoma, which is a condition that can lead to blindness if not treated. And it causes little microhemorrhages in the back of your eyes, in a layer of the back of the eye that's called the retina. So the retina is important because it has little cells in the back that allow us to see. So if you get little blood bleeds and ruptured blood vessels in the back and you don't treat those, well, when you wipe out the retina, you go blind. So it's very important to get a diabetic eye exam every year. Not for vision, for diabetes. Annual diabetic foot exam. Your doctor should be taking off your shoes and looking at your feet at least once a year, And we check for nerve damage, we check for evidence of problems with circulation, we look for bad calluses, ulcers, fissures, tears, anything that can increase your risk of having an amputation, okay? And then always, if you're a diabetic, you should never walk barefooted, okay? You should always wear shoes, right? So annual urine exam, the annual urine exam that we do is not to check for infections. The annual urine exam that we do is to check for evidence of damage to the kidney at the microscopic level that will show up in the urine before it shows up in the blood. And what's the importance of that is because once you show or establish that you have kidney damage at the microscopic level, if you don't get good control of your sugar, if you don't get good control of your blood pressure, if you don't go on the right medication, then you've established a 100% chance of one day ending up on dialysis. Okay? So that's the significance of that test. All right? Your doctor's visit should be every 3 months, minimally. If your sugars are not controlled, then it's going to be more frequent. If your sugars are very well controlled, then it may be less frequent. But minimally, every 3 months. What test do we use as doctors to guide your treatment is that test that's called hemoglobin A1C. The reason that test is very good is because the hemoglobin A1C is a carbohydrate molecule that exists in our blood. Our blood, the cells in our blood, they get recycled every 120 days. The lifespan of our blood cells are 120 days. So by measuring this protein on the blood, I can tell what your average sugar has been for the last 3 months. The goal, depending, right? With pregnancy, we usually shoot for that goal to be less than 6.5. On adults, regular adults, it's less than 7. If you're over the age of 70, it's less than 7.5. Okay? But that's an important, that's the one. So when you come to the doctor and you've been misbehaving, and you come to the doctor and you behave the day before your appointment and stick out your finger and get a sugar of 90, you're like, you see, I'm doing good. But then the A1C shows a 10, you're like, come on, man. All right, so you can't fool us doctors, okay? All right? Okay, and then cholesterol, control of cholesterol is very important. If you're a diabetic, whether you have normal cholesterol or high cholesterol, you need to be on cholesterol medication. And why is that? Because just being a diabetic increases your risk of having a heart attack or a stroke. So whether you have good cholesterol, bad cholesterol, high cholesterol, normal cholesterol, you need to be on cholesterol medication. What we look at more with diabetics is the bad cholesterol, the one that's called LDL, okay? If you are healthy, otherwise diabetic, that goal of the bad cholesterol should always be less than 100. If you have underlying kidney disease, heart disease, brain disease, strokes, vascular disease, anything like that, then it should be less than 70. And those numbers, I know, you guys don't have to know, your doctor has to know, but that way you are informed. And when your doctor tells you, you go to your doctor's visit and say, hey, what was my bad cholesterol, doc? Okay? Right? And then blood pressure. Blood pressure is very important. Goal for diabetes is 140/90. If you have underlying heart disease or vascular disease or have had strokes and stuff like that, then it should be less than 130/80. Okay? All right. So always take your medications the way we prescribe them. Notify your doctor if you're not feeling well with your medications. I have a problem of seeing patients, and I started him on a medication say we started him on a medication 6 months ago. 3 months they came back, they look good. This next 3 months they come back and they look bad. And I'm like, did you stop taking your medication? Well, yes, I wasn't feeling well. Well, but you can't just stop taking your medication. You need to call the doctor so that the doctor can adjust your treatment. You should not adjust your treatment, especially if you're on insulin. Okay? And absolutely no smoking, okay? Smoking alone increases your risk of heart attacks, peripheral vascular disease, strokes, and if you combine diabetes and smoking together, that's like adding gasoline to fire. You will get into trouble, okay? And the most important part of your treatment is going to be changing your diet, weight loss, starting an exercise program. And this is what I always tell the patients. Listen, the more you take care of yourself, the less that I'm going to have to take care of you. That means the more you take care of yourselves, the less medicine that I'm going to have to use. Okay? So a little bit on diet, carbohydrates, sugars, we shoot for a goal of about 100, no more than 120 grams. Some people say 130 grams. You want to be really strict, it's 90 grams, but somewhere around 120 grams. And right now the dietitian will talk about that. Right? So, what are considered, people always ask me, okay, so what if I'm going to eat carbs, like what are the ones that are considered to be healthy? Well, like oats, that's a good cereal to eat. It's rich in protein and has complex carbohydrates that provide nourishment without increasing your sugar levels. Okay? Whole grains, like wheat bread, wheat pasta, oats, we just talked about, quinoa, sweet potato, apples and pears. Although sometimes you can get some very sweet pears, but the benefit of those two are the fiber in it. Some brown rice, lentils, yogurts, and of course the berries. The berries are always good. Those are low sugar, they have a lot of vitamins, they boost your immunity, they decrease inflammation of your body, so they're considered to help prevent cancer and heart attacks. Those are healthy carbs. Okay? Fruits. Now, our culture always thinks that eating a lot of fruit is good for you. It is if you're not a diabetic, okay? But if you're pre-diabetic or diabetic, then you should limit your fruit consumption. 1 cup of fresh fruit per day at the most should be your allowance in fruits in a given day, and you should never eat any canned fruits. Okay? So rice and pasta are okay, but the serving size, which we'll discuss right now, shouldn't be more than the palm of your hand. Shouldn't measure more than that. Just a well portion. We're not asking you to completely not eat anything, but that should be your serving size. All your drinks should be sugar-free. And again, you should avoid fruit juices because those are very high. A fruit juice, as a diabetic, you're allowed only half a cup a day. Okay? Right? So you should eat more vegetables and salads as opposed to rice and pasta. However, be careful with the potatoes. Those are high in carbs. The corn, those are high carbs. So bread, sweet bread, cakes, all that stuff should be out of your menu. Maybe once a year, once a month, once every 6 months or something. Those. Okay. Well, maybe we did something really good once a month. Okay. All right. So chocolates, candies, those should be avoided. And we always encourage a low-fat diet, always, to go along with that. So exercise. The United States Preventive Task Force, which is the task force that sets all the guidelines for everything that we do as far as, immunizations and mammograms and pap smears and all that stuff, recommends 150 minutes of exercise per week. Okay? Now, if you haven't been exercising, you have to start slowly. Okay? Otherwise, you're gonna hurt yourself and you're not gonna want to exercise anymore. So you build gradually. Okay? Always consult your doctor first. Especially if you have high blood pressure and other medical conditions, even kidney problems, because you don't want to get dehydrated and mess up your kidneys more. You always consult with your doctor first before you start on an exercise program. Okay? Always check your sugars prior to exercising. And the reason being, if you're low, when you start exercising, one of the reasons that exercise helps control your sugars is because when you exercise, the body uses the sugar for energy, so your sugar is going to drop. If you're going to start exercising and your sugar is low, guess what's going to happen? You're going to bottom out your sugars and you're not going to feel well. So it's always important to carry a little snack with you if you're a diabetic on medication and you're going to exercise, to take a little snack in case you start feeling bad. Why shouldn't you exercise if your sugar is too high? Because the stress of the exercise, if you go beyond a certain threshold, can actually increase your sugars more. And then very high sugars can end up causing some other problems, and you'll end up in the hospital. So, when your sugars are very high, the body goes into what's called it's called hyperosmolar syndrome. But it's you start urinating too much. Your blood gets very concentrated. Acid builds up in your blood, and then that puts you in the hospital. Okay, so that's important to know that. And then, of course, it's always important to check your feet after your exercise. Make sure that you don't have any ulcers, any blisters, any calluses, that you didn't form any calluses. Things that can result in a risk of infection to your foot, and obviously increase your risk of amputation. Yes.
Por ejemplo, si checaría yo la azúcar en la mañana y la tengo normal, puedo hacer ejercicio en la mañana. Pero si me la checaría en la mañana me sale alta y me espero hasta la tarde, si mi azúcar se normalice, puedo hacer ejercicio entonces en la tarde.
Así está bien. ¿Cómo no? Sí, pero cuando estamos hablando de alto para no hacer ejercicio, estamos hablando si el azúcar anda arriba de 300. ¿Ok? Right? Si anda 150, 200, ahí puede hacer ejercicio porque te va a ayudar a bajar el azúcar. ¿Ok? Right? Yes, sir.
Is there such a thing as a reversal of diabetes?
Yes, there is. And actually, one of them, if you're very overweight, bariatric surgery or weight loss surgery has cured diabetes. So the point there is, if you're a diabetic, now you can't change your genes, right? If your diabetes is related to lifestyle and weight, then you'll be able to become a non-diabetic just by losing weight. We've seen that with these new medications that have come out. The Ozempic, the Mounjaro, people lose 50, 60 pounds and the diabetes goes away. The problem is if you're a thin person and you have diabetes, obviously weight loss is not going to benefit you. At that point, it's just very strong genes, and that will be hard to overcome. You cannot change your genes. You can change your diet, you can change your lifestyle, you can change your weight, all those things to help your diabetes, but unfortunately, if you're a thin person, weight loss, which is the only cure for diabetes, will not benefit you. But obviously, the better you take care of yourself, the less medication you have to be on.
One more question on cell therapy.
On stem cell, they've tried actually stem cell therapy on the pancreas and trying to regenerate the cells that produce the insulin and stuff like that. And that's been investigational for years, but that has not been even close to being approved. Yes. Okay. Yes, ma'am.
¿Se puede nada más controlar la diabetes o se puede quitar por completo?
Las dos cosas. Dependiendo si, es lo que estaba diciendo ahorita, si usted es una persona obesa, controlándose la dieta y perdiendo peso, se le quita el azúcar, ¿verdad? Pero si usted es una persona delgada, la pérdida de peso y el cambio en dieta es la única esperanza que tenemos para quitarse el azúcar. Pero si usted no es una persona obesa, a lo mejor el problema son los genes. Y los genes no los puedes cambiar, ¿verdad? A ese punto, nada más cuidarse para tomar lo menos posible medicina que usted pueda. ¿Ok? Sí se puede curar la azúcar, cuidándose súper bien. ¿Ok?
Tengo una hija de 11 años, ella tiene 3 cirugías de corazón abierto. Hace un mes fuimos al doctor y le salió en 5.8 su nivel de...
Prediabética, pero eso tiene que ver mucho con las medicinas que le van a estar dando para lo del corazón.
Toma aspirina, Epanet y furosemide desde que nació. Tiene 11 años tomándola.
Ya. Lo más importante ahí va a ser cuidarle su peso. ¿Ok?
En su peso está normal al rango que dice la doctora, pero sí le salió en
Fijarse en la dieta, cuidarle la dieta, el azúcar. Okay? Okay. So, in general, a healthy diet, regular physical activity, maintaining normal body weight, avoiding tobacco, those are always good things to help you control your type 2 diabetes and reduce your risk of complications. So, what fits in your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? Okay. Any questions? No questions? No? ¿Más preguntas? Dígame.
Por ejemplo, cuando uno trae la azúcar baja, por ejemplo, yo he estado esta semana en 94, porque soy diabética.
Pero esa azúcar está muy buena. 94 es muy buena.
Fui diabética desde los 50, pero la tuve la pre hasta los 67. Tengo 71 y tengo 4 años tomando la medicina para la presión.
Ujú.
Pero yo trato de cuidarme y trato de hacer ejercicio. Hago ejercicio y me cuido.
Eso es lo que se recomienda, ¿verdad? Aparte de la medicina, su dieta y ejercicio. ¿Ya?
Era que si, por ejemplo, si la traigo 94 hoy, mañana 94, me tengo que tomar como quiera la medicina.
Depende de la medicina que está tomando usted. ¿Cuál medicina toma usted? Yeah. So, esa medicina, aunque el azúcar, esa es la medicina que se usa también en los prediabéticos. Okay? So, es la medicina de las más viejas, pero todavía de las mejores para el azúcar. Esa medicina nunca le va a dar bajón de azúcar. Puede tener un azúcar de 70 y se la puede tomar y no se la va a bajar. Lo bonito de esa medicina es que trabaja solamente si tiene que trabajar. Pero esa medicina ayuda a bajar los niveles de la insulina, ¿okay? En su cuerpo. Eso le ayuda a su presión, eso le ayuda a su colesterol. Yeah. Perfecto. Yeah. Okay. Yes. Yeah. Any other questions? Thank you guys for joining me. Thank you guys for having me. I appreciate your attention. You all have a great day.
Thank you so much. Well, I want to give a big thank you to Dr. Reyes. I know that he is very busy, but he made time to be here. And like I said, it's a plus for us that we have the opportunity to ask questions and continue to learn. And whatever we learn, we share with our families. So once again, thank you very much. Thank you for your time. Our second part of our presentation, going along with all this information on diabetes, we have a presenter. Her name is Cordy Saravia. She is our Employee Wellness Coordinator at UISD, and she's here to talk to us about nutrition. So welcome, Saravia.
Oh, yes, thank you. Minimized it somewhere. And then is it already presentation mode? Yes. That should make it. Oh, thank you. Oh, no, it didn't. Let's try again. No, but I don't want the speaker notes. Let's see. Oh, there we go. Okay, good morning. Thank you for having me here. My name is Cordy Sarabia. I work with Blue Cross Blue Shield, but I am UISD's Employee Wellness Coordinator. So I do have an office at the central office area, and I'm there 100% of the time just to promote employee wellness, whether it's physical wellness, whether it's mental health and wellness. And so I'm very happy to be here today. I am a parent of UISD students. I have 2 daughters. I have an 8-year-old and a 10-year-old. And so I can completely agree with everything that was said about being involved in our kids' lives, being present. I thought that presentation from Dr. Reyes was great, and it's just to kind of piggyback on that and share some information. So this is general. It is a pretty detailed presentation, but I promise not to go into a lot of details. So this is just a little overview of what we're going to talk about today. We're going to speak about some nutrition basics, some serving sizes, which we will be using our hand to kind of talk about, portion control, and then some healthy snack tips. Let's see. I could just click it. I don't want to mess it up. Let's see. So there are different types of nutrition. There's good nutrition and there's poor nutrition. A lot of people get scared when they hear the word nutrition or food, or because we always think of diets and calorie restrictions, and we think about not eating, and we think about sometimes those maybe not as healthy relationships that we have with food. But we do. We need nutrition because our food provides us with energy. And we will speak about the different food groups in a little while. It does help the risk of chronic decreases, the risk of chronic disease like we just heard, and it supports a healthy weight. And then we have poor nutrition. A lot of times, and we do see it, unfortunately, a lot in women, they think that they're eating too much or they have to restrict their calories, and then in reality, they start eating too little, where their body can't function properly. Sometimes we're like, we feel tired, we feel drained, and sometimes it could be because we're not eating enough. Remember, we get our energy from the food that we eat. And then consuming the wrong kinds of food. So when we talk about calories, and the sources of food, I'm going to give the example of like, if you had, a plate that had a chicken breast, some broccoli, maybe a small portion of rice or a healthy carb, and then if you had a fast food restaurant meal. You're gonna get better nutrients, better minerals, better energy from that healthier meal versus that less healthy meal. And it might be the same amount of calories. So it's not always necessarily about the calories. It's not the quantity. Sometimes it's the quality of food that we eat. So these are the basic components of a healthy diet. We're going to talk about each one individually. We're going to talk about fats, carbohydrates, protein. In some of the health education books, they'll count water, and some they won't, but those are our macronutrients. Those are the nutrients that we need, macro meaning big, the most quantity of. So in the presentation, it does get a little specific where you'll see percentages. We won't necessarily speak about that in great detail, but it is there. And then our vitamins and our minerals, micronutrients, just meaning we need them in smaller amounts. So dietary fats, we heard a little bit about fats and about us, maybe not needing them in super large quantities, which is true. You could see that the recommended daily intake is 20 to 35%. And fats always do have a bad rap, but there are some that are better for us than, versus some other ones. Of course, too much of anything can be a bad thing. Too much carbs, too much fats, too much protein, too much sugar. Too much of anything could be not necessarily good for us. We do need some fat for essential survival. They say, that's just could be for like the cushioning of your organs. Fat does add taste, it adds texture to our foods. We're going to talk about saturated and unsaturated fats and how that affects our health. And then I just wanted to make mention, this is where I said it kind of gets technical, but it supplies 9 calories per gram. So that's the largest quantity. So we get more calories out of those fattier foods, if you would. So saturated, trans fat, and unsaturated fats. And I think our next slide. So saturated fats, their source comes from animal. So any of your animal sources. So typically we think about like red meat, for example, but it could be chicken as well. It usually comes in, it says like cheese, butter, so animal products in general. That's why we do choose lower, or we always recommend lower sources, low-fat versions of it. Some people would say, we shouldn't be drinking whole milk anymore unless we're a baby, an infant, or we're an adult over a certain age. The rest of us should be drinking lower-fat versions. The same thing for our butter, for our creams. For our meat, they always say pick leaner proteins, and those would be maybe like your chicken, your fish. If you were choosing ground beef, for example, there's ground turkey. You could choose the one that's like the 97, the 93.7, or the, you want to choose and check those. You want to read the labels. We don't talk about labels, but that's something that's really important as well. Our fried foods, our processed foods, and a lot of times that's what our diet consists of, because we're working, because we have kids, because we're running around with them. Sometimes it's easier to stop and to buy food versus to go home and to make food. And so those are just some of those things. So saturated fats are also mostly solids at room temperature. So think about like your butters. It could be a solid. Think about when you cook a piece of meat. You had like a carne asada, and you put the food in the fridge and you take it out the next day and you see like white, like little speckles of white on it. That's what saturated fat can kind of be, explained as. And what this saturated fat does is it clogs your arteries. So think if, your arteries, this is where your blood flows through. And you're eating this saturated fat, and so it starts to block it. So instead of having this amount of space for your blood to flow through, it gets smaller and smaller and smaller and smaller. So that's kind of the way that we want to think of saturated fats. They raise your total cholesterol, your LDL. Your LDL, and the way I think of it is I think of like low. I think it's bad. Your HDL is your good cholesterol. And the way I always remembered it was H is like happy. Happy, it's good. So those are some of the ones that you get from your unsaturated fats. And there are some examples that are listed there. I won't read them for you, but they're there. And then the same for your monosaturated. That would be one of your better because it lowers your total. So some of your healthier fats, if you would be like when you get them from fish, when you have olive oil, nuts, avocado. So those are things that you want to consume more of. You want to eat more of those better fats and less of those not good fats. And then everything, the huge takeaway is everything in moderation. Just like you could have one piece of candy a month, everything in moderation like that. So carbohydrates, we already heard a little bit about them. They are the macronutrient that we need the largest quantity of, which is when you kind of feel like you're tired, when you kind of feel like you can't think clearly anymore, sometimes when you feel hungry, that could be the reason why. You want to select those better ones though, which we heard about some, and we'll hear some more in a minute. So it's your main source of energy. It supplies 4 calories. So we're going to talk about simple and we're going to talk about complex carbohydrates. So your simple ones are like your sugars, like your regular kind of sugar. So it talks about, and this is where reading your labels is important. People think, oh, yogurt, it's great for you, it's healthy for you. But if you look at the sugar content, now for some of these, it does say in here that it occurs naturally, but you want to look for the added sugar. So sometimes it'll say, or you'll see like the carb content, you'll see like the fiber content, and you'll see the total. And sometimes they don't add up. That's because there's added. You also want to read your ingredients. You want to read the ingredients and see what those ingredients are. If the first, second, third ingredient is sugar, whatever you're eating is mostly sugar then. So those are things that you want to check. That higher your blood sugar. So again, you want to limit those. You want to limit your candy, your desserts, items like that. Your complex carbs are listed into the starches and the fibers. Those would be your whole grains. Those would be your cereals, your vegetables. Again, you kind of want to watch out for some of those potatoes. They get a bad rap. If you're diabetic, it might be slightly different, or it is different from if you're not an individual living with diabetes. But sometimes those items also get bad raps because of what we do. What do we do to our potatoes? We eat them fried, we open them up, we bake them, but then we put butter and sour cream and bacon and all the good stuff, right? Everything in moderation. So that's kind of why sometimes they get a bad rap. So something to be mindful of. And then your fiber. You want to make sure that you're consuming enough fiber. And again, you get that from your fruits, your vegetables, your whole grains. So when you think about carbohydrates, you probably don't think about vegetables. You probably think of bread. But there are complex carbs and they do have fiber, so that's what you want to eat more of. Protein. We need about 10 to 35%. Most of the time, or many times, we overeat protein. We think, oh, we need protein, it's going to help us fill up. It's going to help us feel full. You'll hear people that are trying to either gain weight or to gain muscle talk about protein. As Americans, we overconsume carbs and we overconsume protein. We probably overconsume most of those things. And we'll talk about serving sizes. So it is the main component of muscles, organs, and glands. So when you do hear people saying they're trying to gain muscle, you'll hear them talk about that because it is the main component of muscles. It does help and build and maintain those same things to your muscle, skin, tissues, and then it supplies 4 calories. So there you see 10 to 35%. And remember, you want to choose leaner cuts of protein, leaner sources of protein. Vitamins, there isn't a whole lot to talk about, but on our vitamins, there's just some different types, like your vitamin C, A, D. Some of them are fat soluble and some of them are water soluble, meaning that, remember we said that we do need some fat. It is essential. It is essential to help with those vitamins, with the absorption of those vitamins. And then the same thing with your water soluble. And then where do you get these from? I often get asked, should I be taking a multivitamin, or can I take a multivitamin? There isn't any harm of doing it, of taking a vitamin, but we should be getting these vitamins and minerals from the foods that we eat. So in a minute, you're gonna see on our plate that our plate should be made up of half of fruits and half of vegetables, or a combination of both. And then they always say, you'll see whenever you see different, posters and you see different, flyers out there, it always talks about a rainbow. It always says a rainbow of, colors, because you get different vitamins. You always want to have green leafy vegetables. You want to have red. There's different orange, yellow. So you really want to try to have a variety. What I do is I see what's on sale and what's in season, and I typically buy that, and then I try to incorporate it into my cooking or my diet that day. For my kids' snacks, like today I cut up apple and I gave them apple slices for snack. Strawberries, we eat a lot of berries in my house. Raspberries, blueberries, strawberries. And I try to lead by example, and I try to start my girls from when they're little to now. They don't eat a lot of McDonald's, for example, but sometimes they're like, please, Mom. And then minerals. Our minerals are like our iron, our zinc. It's good for life. It's necessary for life and for good nutrition. They can naturally occur or they could be added. So something to be mindful. But again, if you have and maintain a well-balanced, healthy diet, you should be consuming these. Going back to that vitamin question, if you do take a multivitamin and you have too much of something, your body excretes it. Your body gets rid of it. Water. I was looking over this presentation because we have a variety of them with Blue Cross Blue Shield, and it says, it's vital for our health because it makes up 60%. I've actually read where it's even higher than that. But the bottom line is that our body is mostly made up of water. And so we need to keep ourselves replenished. We do have water loss through sweating, through breathing. It says here, even urinating and bowel movement. In Laredo, it's hot. It's hot. It's always hot in Laredo. So it's important to hydrate yourself if you're doing anything outdoors, before exercising, while exercising. Make it a practice to drink water in the morning with meals. Take it to work. Carry it around with you. This was mine, right? I put mine here. And we still get asked, how much should you drink? There are, formulas where you can find how much you need for your weight, but we still basically say the 8 ounces, the 8 glasses, 8 ounces a day. This bottle of water is 16 ounces. So if I drink this bottle of water, I've had basically 2 servings of water for the day already. So you can do that. You can keep track that way. You can carry around, a container that has the measurements already. So serving sizes, this is my favorite part. So we are going to go ahead and talk about the Choose My Plate. I believe this one came out in 2010. I don't believe they've had a revision since, but it's your basic food groups and serving sizes. And so if you were to go on to the choosemyplate.gov, there is somewhere there where you could put your height, your weight, you could put your activity level, you could put your age and your gender, and it'll give you, it's not a diet plan, but it'll give you serving suggestion sizes. So this is based off of a 2,000 calorie diet, which when you read food labels, that's also what they go off of. And sometimes it's 25 or 2,400, it'll say there. And then another thing, when you're reading labels, you always want to check the serving size first, because sometimes, and it happens in sports drinks, which we really shouldn't be drinking sports drinks just for fun, nor should our children. But if you look at it, sometimes it'll say, this is 2.5 servings. So you read the calories and you're like, oh, it's 100 calories, that's it. But it's 100 2 times or 2.5 times. So you're really drinking 250 calories, for example. Sometimes they'll say that, or it'll say like full bottle, half bottle. So it's important to look at that. But based off of a 2,000 calorie diet, you could see here, the recommendation is 6 ounces of grain every day. So a serving size of grain, which we'll see right now, but to give some examples, is like 1 slice of bread or like 1 tortilla. So we talked about the palm of our hand, and we're going to see some pictures right now with the palm of our hand. But if you go, and I love Danny's restaurant, right? I'm not knocking it, but if you were to go anywhere and get like an enchilada plate, what does your serving of rice look like? Does it look like that much on your plate? No, it's probably like 2 hands, right? Like your rice is like 2 hands, 2 servings. So that's already 2 servings. And then you ate all 3 enchiladas. So that's 3 tortillas that you ate. And then you ate all the rice, right? And so it wasn't 1 palm, it was 2 palms. So you've already had 5 servings of carbohydrates. That's in 1 meal. And then you're like, oh, but it's okay because I had a healthy sandwich for dinner with 2 breads, and they could have been whole wheat, but that's 2 more servings of carbohydrates. So it very quickly adds up when we talk about that. And so 6 ounces a day, and you've already had your enchiladas, your rice, and your sandwich, you're already at 5, 6, 7. And then what did you eat for breakfast? And then maybe you did have some fruits and vegetables, which do count or can count in the carbohydrate category. It counts in the vegetables too, but it can also count in the carbohydrates. So that's just kind of being mindful of that, just being mindful of how much and what we eat. And then you'll see the fruits and the vegetables. You often hear 5 cups per day, and you can see why. That's 2 and 2, 2.5 and 2 is 4. So you want to go ahead, like I said, and have a variety of them. Dairy, 3 cups a day, again, 8 ounces. A slice of cheese counts. I think it's 4 or 6 ounces of yogurt. So again, if you're eating a larger size yogurt, you would check that. Your milk, of course, we want to choose those lower fat versions. And then your meat and your beans. It says about 5.5 ounces a day. 1 egg counts as 1 serving. So you ate 2 eggs in the morning, that's 2. And then a portion of fish, meat, chicken, protein should be about the size of a deck of cards. So think of the size, or think of your hand again. When you go out to eat, does your steak or your chicken look like it's 3 to 4 ounces? No. So you ate the 8-ounce steak. You ate the ribeye that day, and you had eggs, and then you had beans, or you had, and like I said, protein, but it adds up very quickly. So you see how we eat a lot of protein as it is. So you don't have to restrict these things. You just have to be a little bit more mindful, especially if you're trying to maintain a healthy weight, or you're trying to lose weight, or you're just trying to live a more healthy, well-balanced diet. So here are the portion sizes. So every once in a while, I carry around like measuring cups, or I have a little like food scale at my house, and my husband's like, what are you doing? You're crazy. Why are you measuring our food? But I'm not. I'm just trying to learn what a portion size looks like for me. And so sometimes I'll weigh them. So rule of thumb again is your palm is 3 to 4 ounces, which is the standard serving of meat. And then when you see something that says a tablespoon, the general is your thumb. So if you were to look right there and look at your thumb, that's about 2 tablespoons. So often 1 tablespoon of almond butter, peanut butter, whatever type of nut butter that you're having that's the serving size is typically 1 tablespoon. So that would actually be half of that. Whenever you're using butter, you're using creams, it's also usually like a tablespoon. But no, we get it and we like scoop it in there, we mix it all up. So mindful, and there, the fingertip is the teaspoon. So you don't necessarily need a scale. You don't need to have measuring cups. You can use your hand. And then it says here, the front of your closed fist is about half a cup. So when we eat nuts, which are good for us, it's a healthy fat. It can also be a source of protein. You just want to eat. They also say if you cup your hand like this, not the whole thing, but if you cup it and you can fit it in there, or this right here is the serving size for nuts, for example. Or it's a serving size for fruits and vegetables. So it's okay to eat, and I mean, it's okay to eat more fruits and vegetables, right? But that's the average. I know some people that don't eat fruits and vegetables at all. So you want to just slowly start incorporating that. And then you'll see there, the clenched fist is the size about 1 cup, a serving of rice. But a half a cup is usually a recommended serving size. So that's already 2 servings. So there's your 2 carbs again. So like I said, it's very easy. Going? Yes. Yes.
Las medidas que estamos mirando también aplica para los muchachos que hacen deportes.
Pues sí, the portion sizes, sí, todavía. Pero los calorías a lo mejor no. A lo mejor necesitan más porque están haciendo más ejercicio. They're using more energy, so they can go ahead and eat. But the portion sizes, that's the same for everybody. But for children, it might be different for adults and for elderly. And then if you're exercising, and that's the other thing, that's a good question. Because a lot of times people start exercising and they're like, I'm hungrier. Well, yes, because you're burning energy. And so now you need energy. So it's okay to eat. You need to eat, because what happens when you don't is you end up hurting yourself. So it's okay and it's important to eat. It's a matter of eating the right foods. So again, you exercise. Do you eat the lean piece of chicken or fish and vegetables? Or I exercise, I'm gonna go get a burger with fries. So it's really, and it's okay to have burgers and fries, and it's okay to have that, but everything in moderation, right? And for fish, just to go back, we should be consuming fish or seafood, not necessarily seafood, at least about twice a week. That's like I saw some of your faces like, that's the recommendation. So it can be any type of fish, but twice a week, at least twice a week. So snacking ideas, we went over a few of them for the carbohydrates. You want to make sure that they are whole grain, low-fat versions. For fruit, like we were talking about, it does get a bad rap sometimes. It has more of that natural one. If you're an individual that's not living with diabetes, you would be a little bit less, worried about that if you would. If you are an individual living with diabetes, that would be something you would be more mindful of. And then it just has sources of protein. We think about protein and we think about, carne, and we think about, chicken, but their cheese counts. Our Greek yogurts, a lot of them now have like sources of protein. They'll be like, this is a protein yogurt. Hummus, steamed edamame, nuts and seeds. And then this just shows, I think McDonald's stopped, and this is not to knock on McDonald's, but they used to have the Super Size Me. I think Wendy's used to have like Biggie. Now they just say small, medium, or large. But I think it's because they got a really bad rap for that back in the day. So now though, you'll see everything is larger. When you go to the store, the convenience store, and you buy a big gulp, which is the one that's like $1, like the 64 ounce, like the big one, right? It's the less expensive one. It's the one that's always on sale. And then what do we fill it up with? With soda, which is empty calories. It doesn't have vitamins. It doesn't have minerals. It's not a carbohydrate. It's not a source of protein. It's basically sugar, right? And so that's kind of the way that they market it. So here you can see the difference. You also, yes. It depends on how it's prepared. So if you were to, that's a great question also, because if you were to take like a Minute Maid lemonade and you were to look at the back, it actually has more sugar than a Coca-Cola. It has like 2 grams more. So we think, oh, lemonade, it's a healthier option. Because I used to think that before I went into this. And I would say, oh, I'm going to have lemonade. I'm not going to have Coke. It's okay. It's soda. But it actually has, so it depends. I don't know if it's the Minute Maid or the Country Time one. So if it's a lemonade that's maybe freshly made, that doesn't have a lot of sugar, if it's a tea that doesn't have added sugar, that would be a better option. So it really, really depends, but that's why it's important, again, to read your labels, to look and see what your food is made up of or what it has in it. And so there's just some examples here about fast food, about the average sizes of our bagels. Everything comes so large now and so big, and everything is so extra now. So you can just see some pictures here. And that's the other thing. If you're really craving like Whataburger, because we like Whataburger at our home, right? But I get the small one. I get the junior. So that way I still have a little taste, a small amount of fries. I feel better. It happens. And because I still want to enjoy it, but I don't want to overdo it, maybe, right? So, but little swaps like that. It doesn't have to be, oh my God, I'm going to stop eating fast food. I'm going to stop drinking soda. But if you were to sub maybe your soda for a water, if you were to get maybe the smaller size, the junior instead of the big one. If you were to say, okay, I'm going to start eating 1 handful of nuts a day. I'm going to start eating 1 apple a day. I'm going to add 1 fruit. It can be small, realistic changes and choices that you make that can actually have big results. The pizza slices are huge, right? And then you see people like dabbing like the grease off of it. I'm like, well, that's okay. That's okay too, because that's saturated fat. So, and then just smaller portions. They say use smaller dishes at your mealtime. Never eat out of the bag or carton. What happens when you sit down with the bag of chips? You eat the whole bag, right? But if you were to maybe get yourself like a little handful and put it on a plate, put the bag out of sight, out of mind, away, maybe you would be able just to control a little bit more and eat that. Ask for half for smaller portions. Share desserts. Choose food packages in individual servings. So they still do have like those 100-calorie packs and things like that. Oh, look, I didn't even remember it said out of sight, out of mind. But that's out of sight, out of mind. And then these are the resources. There is a lot of information out there on healthy eating and nutrition. Like I said, the big takeaway I would want you to have is just to be mindful, just to have variety, everything in moderation. During the holidays times, it's okay to, have those foods that we like to eat, but we don't necessarily need to eat all 12 tamales. We don't need to eat the dozen. We could just eat a couple. And then if you're like, hey, it's the holidays, it really is a lifestyle. It's really a lifestyle. Does anybody have any questions for me? I kind of would want to be mindful of time, so kind of went through it a little. Yes.
Let me ask you something.
Sure.
Not a reflection on you or the district, but the district is great. But I've taken this up with board member Castillo last time we had a discussion on this. I don't know, the quality of food that's being served in elementary, middle, high school. Have you looked at that? I have. If you compare it with LISD is more nutritious food than they serve. I know, because I've seen it. And I've seen UISD food. So if we're talking about food, what are we really the quality of food? Spending millions and millions of dollars in the kitchen here. It can improve. It needs improvement.
Right, and
I talked to Mr. Castillo, and he said to bring it up before the board, and I will.
okay, yes. My focus is on employee wellness, but I can understand your concerns as I have children in the school district as well. But I think it's a very valid concern, and I do feel that if that's something you feel strongly about, that you should reach out to your board members that can help support that. And it is something that I will take away and I will pass along to our child nutrition program.
Who is in charge of that child nutrition program for all the schools?
For all the schools, Mr. Ramirez. Raul, I always want to call him a different name. Mr. Ramirez. Okay, thank you. Any additional questions or comments? Well, thank you so much for your time today. If you have any questions, I'll stick around after to answer them.
Thank you, Ms. Sarabia, and thank you for that information. We're going to ask Dr. Reyes if we can take a real quick picture, and then we're going to do the raffle. So if y'all could just wait, give us a few seconds. cool. We have a couple of prizes, and so Ms. Villagomez is going to help me out. I'm going to draw the name. She's going to say.
The last four o los cuatro últimos números. 2298. 2298. ¿Quién ganó? ¿Quién ganó?
Got a winner? Yes?
Winner? Yes?
Great.
Yes, 2298. Isabel's on her way. Second one, last four numbers, 2271. 2271. 2271. All right, over there in the back. Monica, please. Okay. Next one is 2304. 2304. All right. Mr. Contreras right here in the front. Yes. Thank you. And the last but not least, Isabel, if you can show the prize. Justo para los tamales. 2282. 2282. Woo! The winner. Para que nos invite a su casa, por favor. Okay.
Well, thank you so much. I hope that you all enjoyed this session. I hope that it was good information for you. We appreciate your time. We appreciate you being here. Muchas gracias. Thank you.